friends, and welcome back to my channel. I'm Nurse Lizzie. In today's video, we're going to be discussing acute otitis media, better known as a middle ear infection. Before we go ahead and get started, please be sure to hit the subscribe button below so you never miss one of my uploads. Don't forget to give this video a thumbs up, share it with your friends and family, and of course, don't forget to check out my website, nurselizzie.com, for more interesting educational facts, life hacks, and everything in between. Now, let's go ahead and get started on talking about acute otitis media. So if you are a current nursing student and you're getting ready to head into pediatric clinicals, this is going to be one of the disorders that you're going to learn about in your class and your studies. So acute otitis media is an infection of the middle ear, very common in our pediatric patients. The two age ranges where we commonly see this type of infection are right around 24 months or 2 years of age, and then again between ages 5 and 6 years old. And we'll talk about some of the reasons for that as we break this down. So with acute otitis media, what we're really looking at is this fluid buildup in the back of the eustachian tube. So first, let's break this down on why a child is more prone to getting a middle ear infection. In younger children, their eustachian tube is shorter, it's more narrow, and it's horizontally placed. So if you remember back to anatomy and physiology, your eustachian tube connects the middle ear to the back of the throat. When a child is having symptoms of like an upper respiratory illness with congestion, any kind of bacterial, viral illness, that can cause this fluid to build up in the eustachian tube. It has nowhere to go and it can't essentially drain the way it's supposed to. What happens is you can begin to have this bacteria accumulate in the middle ear, and it's essentially this fluid pooling, which I think of it as dirty pond water because it's just sitting there and it has nowhere to go. So what we will see with the child then, if a parent brought them in for examination to really determine what's going on with them, when the physician or the provider looks with the otoscope at the tympanic membrane, normally it would be a grayish color. What they would see with a middle ear infection would be this bright reddened appearance, or even more of a yellow pustulent type of appearance of the tympanic membrane, known as the eardrum. So what signs and symptoms may have prompted the parents to bring the child in, or what things might they be complaining of? Well, this would be the child that could develop a fever, fever out of the blue. We may have known that they had a recent upper respiratory illness with, parents might say, like runny nose. We've noticed a cough, congestion, those things. They may or may not have some pulling or tugging at their ear. That's a way that a baby or a young toddler can indicate pain and discomfort when they just don't have the words to say, my ear hurts. Other things we can see, especially with babies, would be changes in their feeding. They may normally breastfeed or bottle feed for a certain amount of time, where with a baby with a middle ear infection, they're just so uncomfortable. It hurts when they're sucking and trying to swallow, to where we'll see, or we'll have parents report to us changes in that regular intake. Crying, fussiness, decreased appetite altogether. Of course, pain. If it's an older child, they may be able to express that to us, or complaining of like a feeling of fullness in the ears. Nasal congestion. Again, if they have a concurrent upper respiratory infection, that makes sense. Or any kind of drainage that parents may have noted from the ears are some general signs and symptoms that we may see reported within acute otitis media. So how do we confirm the diagnosis? Well, we're going to take the signs and symptoms and, of course, the history and physical reports that parents give to us, along with examining the child. The provider is going to confirm the diagnosis utilizing the otoscope to visualize that eardrum or the tympanic membrane. Assessment-wise, what we'll see is that inflammation or reddened eardrum, or possibly some fluid in the ear. The good news is acute otitis media is a very treatable condition. What we do worry about is with children that have prolonged or repetitive infections, they do have a risk of developing scar tissue. That scar tissue over time can cause some hearing loss, and that can lead to speech delay. Remember, in pediatrics, we always want to focus on normal growth and development. So we want to ensure that that child or that baby is meeting milestones. So we really want to combat these chronic or persistent ear infections early on to prevent the speech delays or hearing loss from occurring. Age, as I mentioned, it's very common around 24 months of age, and then again around ages 5 to 6 years old. As a child continues to grow and get older, you're not going to be seeing them coming back in for acute middle ear infections. It becomes more rare the older that they get. So let's look and focus on some of our causes. Allergies. A child who has, seasonal allergies, which can really kick up the congestion, it makes sense. It can absolutely impact that drainage from the eustachian tube and that buildup of fluid. Bacteria. So streptococcus is a very common cause of acute middle ear infection. Viral illnesses like our RSV, respiratory syncytial virus, or influenza. Those recurrent upper respiratory infections, especially during cold and flu season where kids are having repeated infections back to back to back. Feeding. Really important that babies who are being breastfed or bottle fed, if they're really not upright during a feeding, that can certainly impact that fluid and pressure inside the middle ear, leading to a source of infection. Secondhand smoke exposure in the home as well. I don't have this up on the screen, but it's really worth mentioning. Our young ones that are in a daycare setting are more prone to ear infections. The reason for that is because they have more exposure to viruses and bacteria, especially in young toddlers where they're, touching and playing with everyone, but not necessarily washing their hands. Those sources of infection can absolutely lead to an acute otitis media as well. As I mentioned, our big risk with recurrent infections would be the fact that we could have this scar tissue develop inside the ear, which could lead to hearing loss and speech delay. So really important that we combat this early on and we prevent that from happening for the child. The good news is, as I mentioned, an acute otitis media is a completely treatable condition. We actually will treat typically with amoxicillin, which is an antibiotic, for 10 to 14 days. That's the first line of treatment unless there's a contraindication like an allergy. Secondly, we're going to encourage parents. A lot of providers will recommend giving acetaminophen, which is our Tylenol, or an ibuprofen or Motrin as needed for discomfort, pain, and fever management. Of course, comfort, extra snuggles, really encouraging fluids so that they don't become dehydrated are all things we can do to help promote comfort. Where we want to start to have conversations with our parents who may have a child who's experiencing these chronic acute otitis media infections. Again, as I mentioned, we want to prevent that hearing loss from occurring and speech delay. We may consider placing tubes in the ears of a child with repeat infections, better known as a myringotomy. This is a very simple same-day procedure. It's incredibly common in pediatrics. What they do, just so you have a little idea, if you've ever heard somebody say, my child needed tubes placed in their ears, the fancy word for that is that myringotomy. They'll actually place the child under general anesthesia. The procedure itself only takes about 15 to 20 minutes, and they will make an incision in the tympanic membrane. They'll place the small tube that allows for airflow, ventilation, to equalize pressure and allow for air to get into that space to prevent this growth of bacteria. That's that procedure known as the myringotomy, aka my child had tubes in their ears. That's the same procedure. So just know that if, as you're working with parents in the general public and you start to see the same kids perhaps for the same type of problem, we may be looking at the myringotomy long-term just to prevent any long-term complications. I hope this helped to answer some of your questions or served as a quick review on acute otitis media. Be sure to check the link below and nurselizzie.com for a helpful study guide and tips as you're studying for your next nursing exam. Thanks so much for watching. Bye.